Thanks for the nice remarks. You can see me okay and all of that, right? Okay.
Yes.
And I managed to catch part of the very lively discussion. And I wanted to say I've been working with a lot of COVID data. My presentation will be a bit of an overview of using data for a lot of things and the basics of it, but I'll bring up COVID, and I'm happy to discuss all the way numbers are manipulated in different places in the US and throughout the world. We're still getting a lot of very fuzzy numbers, so it's not restricted to one region or one country. And the political use of the data um, is pretty widespread. So that's a good reason to understand data and numbers and do some of your own numbers and on your own data too. So with that, I'll go ahead and start, Karen, and I'll
Yes.
count on
Thank you.
you to keep watch on the clock. Okay, thanks. So let's see if we can successfully share a screen. Okay, let's go ahead and go from the beginning. So this is an overview of data journalism, but there's no way we can be doing data journalism these days without thinking of COVID and of all the stories. So I'll pop in and out of COVID matters throughout. So at this point, it's really more important than ever in the time of COVID-19 to understand and know how to use data. Here we go here. And it's also important to understand the hierarchy of data sources. And by that, I mean, when something is crossing borders, you want to think about it in a sort of order of where the data is coming from in terms of the world and regions and countries. So we have global data, we have national data, and we have the local data. Seldom will the numbers match up, but by piecing together data from those three areas, we can kind of draw a better picture of what's really going on. So data is like doing what we used to call, and still call it, doing a document trail, except you can deal with many more records. And so following the data trail, it's easier to keep track of the records simply by using data. And I hope everybody is familiar with or getting familiar with spreadsheets, because that is a basic tool of being a journalist these days. And of course, if you use something called a database manager, it's easier to cross-reference between different data sets, just something to keep in mind. And then of course, it's easier when you have documents converted to data. It's much easier to analyze and visualize, and we're getting used to seeing all of this, but there's a lot of it we can do ourselves. So what we want to do is have a data state of mind in reporting now. And that means that when somebody is talking about anything, you not only say, oh, is there a memo or report for that, but is there a database? Is there a data set? Are there more than one, or there's several of them? So you're always looking for a database to support the story, something to give a foundation to the story, or something to challenge what somebody is saying as fact. If there is a form of any kind on the web, or if there's a paper form, you can just assume that there is a database behind it, and you want to get as much of that database as you can, because otherwise you're just sort of being fed pellets of information without any relation. If there's a report, you're reading a report of any kind, there's probably a database or databases behind it. You want to get that database. And if there's a digital map, there's definitely a database behind it. I've had some people deny us the columns and rows of address information behind a map, but sometimes you can just click on a map, and especially if it's an Esri map, and click for attributes, and suddenly the Excel worksheet will appear behind that, and you can easily download it. Again, there's always data behind it, even if an official is pretending there isn't. So sources of data. I want to get data from lots of different places. Government data is official. Sometimes it's reliable, sometimes it's not. COVID-19 has been a great tutorial in unreliable or spun government data. There's business and corporate data. Quite often that can be a little more accurate because people are really trying to make money and they need accurate data. There's institutional data. Institutional could be something like a think tank, Brookings, things like that. They're institutions that are really trying to get into data, and they sometimes get to data sets that we can as journalists, and then we can get them to share them with us. And they can be academics, of course, academic data. We want to think constantly about the data that crosses borders. That's regional and international. In the previous session, we're talking about that. You want to reach across the borders to get a better idea of what's going on in your region, city, country. Advocacy groups. This can be a little touchy at times, but there are a good number of advocacy groups out there that get really good data and share it. Now, they're going to get the data and spin it to make it look like their position is supported. So long as you know where they're getting the data and they're totally transparent about it, it's possible to use that data and still have credibility. There are a number of places in the US, the Environmental Working Group, for example, that gets agriculture data, that is solid data, and they do their reports, but they'll also share it. So getting COVID-19 data on countries, this is a little repetitive, but at this point, it's not bad to be repetitive. World Health Organization, there's good discussion about that. We know they've made wrong calls on things. We know they collect data in a certain way, but they are a standard data source you have to pay attention to and get information from. So there's their link, and this presentation will be available to you. Johns Hopkins, a major medical center and research center in the United States, has been doing really incredible work in terms of telling people what the public health standards are for reporting. For example, there's something very popular out there called the positivity rate. In fact, if you look at the Johns Hopkins literature and you look at how different places are calculating a positivity rate, which is simple to do, you'll see that there are a lot of inaccurate positivity rates. And definitely in the US, that is a political tool to reopen. And there's their link. University of Washington, in the state of Washington, in the US, has been doing a lot of work, and their projections have often been used by the US and other countries in terms of projections of cases and fatalities. And there's their link. There's, of course, I'm sure you're familiar with this, but I'm just listing places I'm taking a look at. This is Esri, which is a mapping company that does a lot of government data. It's sort of interesting. I'm watching, seeing what they're doing with their Caribbean geoportal on COVID-19 responses. This is another one. It may have been mentioned before, but it looks interesting to me. It looks like they're doing some solid work. And I like it. This is a Center for Economic and Policy Research, because one of the huge stories of COVID, of course, is the damage to the economy. I don't know if I should have met them. Reuters is doing some really good visual work. They always do. And maybe if we have time, I can show a little what they're up to if people want to see that and aren't necessarily familiar with it. So that's just sort of a shorthand set of links, another set of links to getting data on COVID-19. So in terms of getting data in general, there are different ways we can get it. One is online, and that's our favorite way, free, online, easily downloadable. Sometimes it isn't, so we need a tool to deal with it, particularly PDF. We get through informal requests and freedom of information request, leaks from sources, of course, leaks that the International Consortium of Investigative Journalists use have been impressive and shared with people all over the world. And then there's the other one, and this may sound odd, but sometimes there's data sitting there, not just say text information, but just data that you want to build your own database. And I've actually been helping students in the region I work in Illinois, sort of reshape some of the COVID-19 data so that you can see the cumulative impact and the cumulative number of cases. We did this for 6 months until finally our local public health officials finally did cumulative charts and information. Where are we using data for? Context and comparison. You can get a minimum story, enterprise or investigative story, actually just comparing data from different contiguous regions or cities or countries, just its automatic story. Outliers. Data shows us outliers, and outliers are what's ever at the top of the curve or the bottom of the curve. That is the richest people, the poorest people, the most expensive housing, the least expensive housing. Outliers often can be stories for us because they show the extremes. Clearly, in the time of COVID-19, an outlier is where the biggest cluster is or outbreak of COVID-19, and we were very interested in outliers. And of course, data allows trends, and of course, we're seeing that in COVID-19, and we can see the trends of cases increasing or decreasing or whatever. And then one of the things I love about databases is they provide tips. There are times that you can be looking at a database and get a tip on a good story, and whoever you're reporting on thinks someone is leaking to you from inside the agency, but actually you just looked at data the agency has that it never looks at, and you end up getting a really good story. Key elements of a database. If you're going to get a data set and you're looking at a data set, you really want to get a record layout, which tells you what the headers are for the columns, what those headers mean. It allows you to know how many different columns of information there are. You also want some kind of code translator. A lot of times people use 1, 2, 3, 4, 5 for ethnicity, for a kind of crime. The data is useless unless you have a code translator. So you want to have that. Sorry for the misspelling. You want to know what a record is. That is, how is it defined? You might think a record is one thing when you're looking at campaign contributions, but that record actually represents a check. And then you really want to understand calculated columns. Those are columns calculated from other columns, additions, subtractions, multiplications. You'll be surprised how often government agencies get those wrong. So let's go over the basic skills really quickly. And I'm watching my time here. So a basic skill you want to have is finding or creating databases. Downloading and cleaning the data. Cleaning the data means correcting misspellings, particularly of names, places, things. You want to be able to do basic analysis, and what I want to emphasize today is the best analysis tool, the first one to use, I think, per journalist, is the pivot table in a spreadsheet. And then, of course, we want to visualize everything we're doing with data because people expect it. It also allows us to see what the story is much more quickly. These are basic skills we want to have. The basic tools, well, we see a lot of PDFs floating out there on the web, or we get them electronically. If you've dealt with them, you know you hate them. They're petrified information. They're just the equivalent of hard copy. Fortunately, we have a lot of tools to convert these. A second basic tool and convert them to spreadsheets. And the second basic tool, which I mentioned, is the spreadsheet. We all have to have skills with that. The database manager allows you to join together and compare 2 or more data sets. It's extremely powerful. If you get comfortable with spreadsheets, you want to think about database manager. And then visualizing data, it's gotten so much easier. You can do it in Excel, but there are nice tools out there. I think Denise will be talking about Tableau. I like Data Wrapper for quick visualizations. So I like that a lot. Advanced tools. Web scraping is getting easier. It still takes a while to work with it. Web scraping is basically going to a website that only gives you a few records or just a group of records of a data set that you want, which you want all of it. You don't want just those little groups or one at a time. A web scraper says, basically it's automatic program, says give me one record, give me another, and it just kind of scrapes it off the web and puts it into columns and rows for you. Advanced tools, coding to clean and analyze data. You'll hear people talking about Python and R. 95% of what's going on data journalism now is done with a spreadsheet, but there are people that can really use these tools effectively for large data sets. And then we're getting into text mining, and that's taking text and turning it into structured data in columns and rows. The people are doing that. If you want a visualization of text mining, think of a word cloud. It's just counting the number of words used in a speech or a meeting or something like that. So I wanted to show a few tools quickly. There's Acrobat and Tabula can take PDFs to convert them quickly. There's Comment Docs that's a pretty, it's a free tool. You can get a premium and pay for it, but the free tool is nice for small PDFs. They're in columns and rows. You basically upload it, you send it to Comment Docs for free. You say you want to convert it into a spreadsheet, and in a short amount of time, it's emailed back to you. It's a nice, easy tool if you don't have Acrobat handy or haven't learned Tabula. The spreadsheet, we're all used to seeing all these numbers, even though these are blurry. Microsoft Excel has a lot of features there. It's worth having that because it's better than a lot. Google Sheets has gotten better. People talk about Open Office Calc. I don't use that, but it is there and it's free. What do we use a spreadsheet for? Sorting, filtering, and summarizing. This is data management. And with these doing these three things, you never have to do a calculation. You don't have to do any math. It's basically counts for you. And then of course charts are doing the same thing and counting for you. And then there are the basic calculations in spreadsheets: add, subtract, multiply, divide. One thing I always emphasize is don't forget about median, which is the middle point of a row or column of numbers. It means half the numbers are higher than the median and half are lower. It's a great lie detector because governments in particular and corporations love to give you averages, and averages hide a lot of things. And they hide the fact that you say if you put a CEO's salary among other employee salaries, it makes all the other employee salaries look much higher than they are. The same thing with housing, but median is what people that do stats really care about. It's much more accurate than average in many cases. And percentage difference is a way we can level the playing field between different records, different departments or whatever. Instead of just saying what the raw number difference is, a percentage difference can give us some idea of the real impact. And then rates and ratios, which I like a lot because people understand those better and they're easier to write about. Something is 2 times as much, 3 times as much. and a ratio that's a lot easier to understand. And rates gives us a much more accurate way at looking at incidents and occurrences. You want to know whether or not, if you're looking at road accidents, whether there's a high rate. You don't want just number of accidents, you want the rate per number of vehicles to go through. And of course, now we think about rates all the time in COVID-19. We want to make sure we understand how they're calculating infection rates and other kinds of rates, like positivity. Another tool is the database manager. I won't get into that. Just know about it. There's an easy code language behind it called structured query language. It's very easy to use, and it's also visualized, but just know that it's out there if you want to compare 2 or more data sets and the information in them. So database managers handle big data sets. You can search records quickly, you can summarize with them. And again, the big power of it is allow one or more files to be joined for comparison and investigation. SQL, I've mentioned that. The one that's come along fast is SQLite. You can download it for free onto any kind of laptop or computer. So SQLbrowser.org, if you get into it, it's a good one to use. And there's MySQL. So mapping. This is the dashboard. Dashboards are everywhere now. This is the one at Johns Hopkins University for COVID. Obviously, I took this this particular screenshot a while ago. But in any case, this is updated daily, and it really shows the power of tracking this. Data Wrapper, Tableau, and Esri Arc Online are really good mapping software. I love Esri. They will give journalists free accounts of much of their stuff. What they have is thousands and thousands of data sets from around the world for various governments, because they have helped so many governments with their mapping. So just be aware that Esri is just not a mapping tool, it's a huge data repository. So data state of mind, you want to quantify, not tell an anecdote. You want to treat data as a source. You want to interview the data. Think about interviewing, asking one question of the data, asking another question. And again, we have to be skeptical of the data. In my experience, no database is perfect or complete. So you always need to know the flaws of the database. In addition, there are questions you always need to ask. Who collects the data? How did they collect it? What is their interest in collecting the data? And again, most important, what is missing in the data? And of course, we're facing that COVID-19 stories all the time. If you build your own database, you have a reason. You have to have a good reason. One is sometimes the data doesn't already exist. That's great if you have time to build a database because you have exclusive stories. You want to build your own database if you're obtaining records over a period of time. You need to combine the information. And you want to build your own database to uncover potential stories that no one else is doing. I've gotten a lot of exclusive stories, and my students have, by just building a simple database. Sometimes a database with just 40 records can be effective. I once discovered that a serial killer was operating in the city of Hartford simply by looking at a database I constructed of newspaper clippings of unsolved crimes. And it turned out that 8 women had been killed who were from the same small area of the city. No policemen had been looking at that. And that was only 40 records. It took half a day to build. Data visualization, just a little bit of history, which is, despite the fact we hate numbers, newspapers were putting out sorts of data. This is an old clip that a lot of people are using that show expenditures at schools in the United Kingdom. We have effectively used pie charts for a long time now. This is water use, came out of USA Today. The bubble maps are getting much more popular. They're not hard to make. Tableau loves bubble maps. This is one I wanted to make sure to show you with the link. If you're trying to tell anybody that it's a complex task to figure out all the strains of COVID-19 in the world, this is an open source genomic epidemiology project by scientists all over the world who are basically tracking the different strains. And this is an interactive map. So it's really nice, and it can show you what country or what area has what particular strain, and it's also following the mutations. But when people say we should be able to get a vaccine quickly, I think I direct them to this map. Other maps, something to keep in mind is we were slow to really use mapping in agriculture. It's incredibly useful in agriculture and anything in land use. You can also look at a project from Nepal, which is earthquake victims. And then they did a simple thing to see all the disaster money coming in and how it wasn't spent and how little impact it had. And of course, we've done these stories all over the world. This one isn't interactive, but if you went to this, you could see that you have make it easy visualizations that just show change over time. Sometimes mapping reveals something's going on that it's not easy to see when you're on the ground. This was really interesting. A Reuters photographer was sort of geocoding his photos and figured out that you had all these latrines near water resources in this area. This is, we've seen a lot of maps of Afghanistan and war statistics and attacks. Road traffic fatalities have been tracked by the World Health Organization in a really big project. And a lot of people have been using that or getting their own data. So there are a lot of visualizations you can see with this. And again, here's the next strain. I want to make sure you saw that. And then this is of interest to anybody living on the coast or an island, obviously Caribbean, what's happening with not just wetlands, but with the coast and the beaches. I wanted to finish and then get into questions, or we can look at some other stuff. More generic links to data, all sorts of data, not just COVID-19. And pointing out a couple that people are using from all over the world, journalists are using. So at this point, I open up for questions, and I have the potential, of course, to show some of the sites. So Karen, do we have any questions or?
Any questions,
okay.
anyone? You can open your microphone or put your questions in the chat box.
Just 1 second. Could you please go back to the previous slide 1 minute, please?
This one?
Sorry, yes, you.
That one?
Right here. Right. Thanks.
Okay. And just know that this will be available, so, and the links should still work. So don't worry about writing down all this stuff.
Okay. Any questions? The floor is open now for questions.
Please, Cyrus, can you review the median? You're talking about the lie detector.
Yeah. So, well, I'll just talk about it and possibly show you. The simplest way, and the way I understood it, because I try to keep everything simple, is if you were to sort numbers 1 through 5, the median would be 3. And that is because numbers 1 and 2 are above 3 and 4 and 5. So median is that midpoint. And what median is good for, we found out when we were reporting on sports salaries in the 1990s, there was a big union, players union in baseball, and there were the owners. And it turns out by reporting the average player's salary, journalists were taking the side of the owners without realizing it. Because we know in all sports teams, there's a superstar. So basically, there were two different negotiations. And one of them, the average salary for a baseball player was $1 million. But the median salary was more like 150,000, which is a lot of money. But on the other hand, some of them are only playing 3 or 4 years. But the owners were citing the average salary. Okay. And that meant they were putting in the superstar salary into the average so that everybody's salary was raised. Mm-hmm. And so we're reporting the average salary and making the baseball players look like incredibly greedy people. So that's why the median can be important. You can apply the median to any sorts of numbers. Now median, to really understand how the virus is hitting a country, overall, you would want the median because we know we're going to have clusters. So we'll have regions and places where there are outbreaks and outbursts of this virus. But in any case, just think of it as a stack of books, each one with a number on them, and you sort them 1, 2, 3, 4, 5. 3 is the median. You can keep stacking up and stacking all the way, and the median keeps going up until you're right in the middle of all that stack.
Thank you.
Okay. Any other questions, group?
Yes, I have 2 questions. I believe it's an excellent presentation, by the way. I don't know if you're Mr. or Dr. Houston, just to say excellent presentation. I want to
Just
ask
Brant
you
Houston, journalist.
Oh, okay, sorry, no problem.
You can call me professor.
Okay, I just wanted to know, you speak about the bubble map, and I don't know if you could shed a little bit more details on it, and also the web scraper. Can someone download the web scraper on my laptop? The content editor for the Jamaica Statistical Society newsletter. And I wanted to use a web scraper. How do I go about using it and using the bubble map?
Well, there are a couple of, the scraper itself is going to, in general, the simpler ones, and there's some with Google Tools, and I'll make sure to send a link to this nice tutorial another professor journalist has put together. But Google has some relatively simple scraping tools. So you can look at their digital tools and try it out. It is a little complicated, but not, you know, a lot of stuff you want isn't so complicated. So I can get that to you and you can give it a try. And there are tutorials in it also in that tool.
Okay, thanks. Yes, thank you.
Yeah, the main thing is you want to get the data in columns and rows that you can filter and sort and manage. That's your goal. Once you've got it in columns and rows, everything opens up to you. All the visualizations, everything. So that's the key.
Any more questions, guys, before we move on? Okay, Brant, I think you could continue. Thanks.
Okay, so what I'm gonna do here, I'm gonna stop sharing, give me a minute. I wanna get to something that is on the web. And I'll be right back there. If there are any questions, it's a good time to do it while I take my time fiddling around here. Okay.
Okay, we have one from Andreen. What, in your experience, are some of the main reasons government data can be unreliable?
Okay. That can be a long list. First of all, unreliable because they don't collect it. And that's why what's missing. Unreliable because they collect it, but they redact it. They hold it back. That's unreliable. How do you know you can be accurate if you can't see the whole picture? Unreliable because they're sloppy. Or they're rushed, or they don't have enough money to actually pay people enough to accurately type information in. The great thing about pivot table for, the easier databases is a pivot table allows you to summarize data by a town, a city, a country. And then you've got it sorted in the pivot table automatically, alphabetically. And that's where, for example, you would think this would be simple in the state I live in the US, that Chicago would be an easy city to spell. I've actually gotten Chicago in a database that is spelled 3 or 4 different ways. So it's not collected, it's not given out, it's collected sloppily. So those are that. Then the worst case scenario is you have that the data is being manipulated in ways that it's hard to tell. That's why when I get a database, I want the whole database. Because as we all know, government officials and corporate officials control us by limiting the information we can get. That's another reason that I think everybody pretty much hates in general the one source, one interview story. I don't like the one database story if I can help it. I like to have 2 or 3 databases about the same thing, and that allows me to see things much more accurately. Okay.
Thanks for that, Brant. Anybody else before we move on? Brant, just tell me when you're ready.
Okay. I should be ready. Let's see how it works. Okay. I'm going to bounce onto the web here for a second, for a little bit. So, all right. Let's make sure I've got the right one here. Since we've been talking about COVID and data, I thought I'd show you one of the data sets I'm looking at, and then I'll show you another one. And this is more a case of why I like different data sets on information. So in the state of Illinois, where we've had a fairly strong outbreak, the state is doing a fairly good job of giving us a lot of different data. Now, one of the reasons I bring this up is because sometimes you look at something like this and go, well, there's way too much information. Well, spend a little time with it and read it, and you'll find all sorts of interesting things. And remember, I was talking about definitions of records. So we got started on a story when we were looking at recovered cases, and this is a real interesting data to look at, 96% recovery rate. It makes everybody feel like this is not such a bad virus, just 96% recovered. Well, it turns out recovered is defined differently throughout the world and the United States. You know how they label somebody recovered in Illinois? They have not died since 42 days of the initial diagnosis. Imagine that. You could be in a hospital on a ventilator. You could be near death's door, but you haven't died within 42 days. There are all sorts of definitions. So just by reading how they define something, you can get a story. Now let's see if we can go down here. So another thing is, this is the county I live in. And if I have enough time, I'll show you what my county reports. This is from yesterday. We've had 5,389 cases, 27 deaths. We've had fewer deaths than others, but I'm going to come back to that. There's all this other data that's available here, and a lot of people don't go into it. So I'll just bounce into a couple of things here. Now, this is all nice data sitting there for us. We did a story here where we used a database manager, and most of the students that come to the University of Illinois come from Illinois, And so we realized we had the demographics, not their names, but the numbers of students from each zip code in Illinois. Well, we matched that with the zip codes in this map of cases. So we took the zip codes, we downloaded this, and then we went ahead and calculated the infection rate from each of these zip codes. And we found that 20,000 out of 30,000 students were coming from zip codes that had much higher rates of infection than the rest of, than the Champaign County. So you can sort of see all of these different figures. So again, you go, well, the data is all set there, it's all for me, but actually the data is sitting up there to really be used to create other different stories. Many of our cases or deaths have occurred at long-term care facilities. This is true around the world, especially in Sweden. You can easily go there and look at a series of counties and put together your own data set of that. So for example, the local paper here is so understaffed that I'm having my students take a look at all the outbreaks that have been in nursing homes, long-term facilities in this county. And people, there's so few reporters, this is not getting reported very often by the mainstream media. So again, when you see data up on the web, there's so much more you can usually do with it because they're not keeping it necessarily in the form that we want to use it or we want to have it. One other thing to take a look at that they give that people aren't keeping a close eye on is they're measuring all sorts of targets that they want to have. And Champaign County compliments itself on meeting all the targets, except the local newspaper, local media seldom reports that we have a lot of cases, infections per 100,000. The target's less than 50, and we have 161. So again, you can take this data, compare it to other data, create a new Excel worksheet, end up with quite a story. And they also, a lot of these data sets have time series and trends, which no one's taking a look at. Now, I'll switch over really quickly to here. This is another data set, a set of data. This is from the county itself I live in. Notice that the number from yesterday was 5,289. Now they're up to 5,331. They're still underreporting the cases by day because they want to contact people about whether they're truly infected. In the end, they catch up to the state. This is a new set of data that they're now doing a really good job. They didn't have a lot of this data before, the cumulative data, but they also show the clusters of infections and so forth. So what they're doing here is nice, except they still are always behind on the number of cases that are really occurring. But now, if I'd shown this to you last week, I would have been criticizing how bad it was because they did not have this line of the total cumulative effect of what was going on. I'm going to do you have time for one more, Kieran? And do I have any questions?
Any questions? Group?
No questions?
No.
Okay. Okay, we're going to still be doing this. This is a newsroom that I work in. I think it's always good to show the practical things that you can do with data, no matter how small an organization or limited the reporters. This is pretty much the work of reporters who are taking several classes but want to have a portfolio. And we were doing this because the county wasn't doing for our cases, but I just wanted to show how some of these stories look. Okay, let's go here. I'm gonna go up here. Let me go up to this one to pick up some stories we've done. Okay. So let's take a look at this one. So in this case, simply by keeping track of data, one of the big stories we've had, and it's been a national story too, is that this University of Illinois said it would do a lot of testing, and that will allow us to quarantine people, isolate them, and keep the number of cases down. And so there are all these computer models that most we would have 700 cases by Thanksgiving. By just simply keeping track of all the data, it turns out by September 8th, we already had 1,700 cases. We're closing in on 3,000 cases. Simple data story, really easy to do. We've also done a lot on infections among people in meat processing plants. And let me go back to one here and show you one more thing out of public health. Let's grab this. See if we can get down here, go back here. Okay, I'll do a couple more. Are there any questions?
Any questions, group?
Okay, so in the world of data, I'll finish with this because this was a nice scoop. Many areas around the world, officials are not telling us exactly where outbreaks occur. And by the way, when you're reporting on COVID-19, this is really a virus of outbreaks and almost random outbreaks because we don't know all the factors. It does not march along in a determined fashion like the flu. So knowing where outbreaks are and where clusters are is really important. Well, it turns out that the state and the counties in Illinois would not tell us exactly where the outbreaks were unless you heard about it and you called them, and then they might confirm it. Well, by doing a series of Freedom of Information requests, by chance, the team of reporters on this got a confidential database that the state was keeping of outbreaks across the state, and that it only shared back with the counties who were giving it the information. So one of the counties by mistake gave us this data set, and we're able to localize it. We did a state story, but we care about Champaign, my students, because we live here. And you could see this is a Tableau, little bubble map of where all the outbreaks were. Only a small fraction of these outbreaks have been publicly reported. So we not only talked about where the outbreaks were, we took the data, put it into Tableau, and now people can go and see if they've been going to places where there've been outbreaks, how bad the outbreaks have been. In terms of being trustworthy data, these are close, but we know that there are mistakes in this data set. It was put together quickly, but we know that this pretty much underestimates the number of cases at each one. Again, this wasn't hard to do or embed in a website. We are on the verge of having a team of student reporters just call to every place we got a tip on to put something like this together and then get it confirmed by the county. Fortunately, somebody just sent one of the reporters a spreadsheet for the whole state, and we could break it down by county. And so that's the power of of data. I'll go to one other place we have. On this one, you see the larger one. We have a lot of this called the Midwest Center. And this is what we did with the state database, because this is more regional. And we actually made all the data available on the web, so the public can go in and put in their city or a street or a business and find out whether it's had outbreaks. So that's pretty much, I think, one of the really nice examples of the power of getting a good spreadsheet and going to town with it. And notice that you can download this data, anyone in the state, by just going here, and they'll get the entire spreadsheet that we discovered through a Freedom of Information request. So, any questions? I know I'm at the end of time, but I'm available. My email is brant.houston@gmail.com. That's my name. Gmail.com is what I use outside the university. So if you've got story problems or issues or ideas you want to talk about, I'm around.
Thank you, Brant. Guys, any questions? I noticed that Suzanne Goff, Suzanne, hi, thanks for being with us. You mentioned the situation in Jamaica with the presentation of data, in that the date and date range of samples isn't given in updates by the Ministry of Health, and it was a particular problem during July and August with a backlog of samples. I think a lot of countries in the region are experiencing this. I have two suggestions. One is, maybe the Press Association or the Media Association of Jamaica, or both, can write a letter to the minister and to the CMO, asking for the information and saying how you would like the information represented. Sometimes it's good to work through those kinds of organizations, or even an entity like NIA, National Integrity Action. For the rest of the region, I wanted to suggest a similar approach, where the press associations can do a formal letter requesting the information and get your civil society, partners, Transparency International, their equivalent, to also request the information. Sometimes that helps. Failing that, I will always go back to saying we need to call on the Freedom of Information and Access to Information Acts, those of us who have it, to try and get the information. So I just wanted to comment on that. Any questions or thoughts, anyone?
Somebody raised their hand.
Yes. Hi, good morning. I am Melissa Benjamin from Trinidad and Tobago, Isaac 98.1 FM. And I'm just have a comment, a small comment to make. In terms of the way the data is being presented in the US, right, in Illinois, we don't really have much of that. I know that we don't have much of that in Trinidad and Tobago, or maybe in the Caribbean per se. Could you give me a reason why that is so?
You're asking me? I think
what specifically about the Illinois figures you're concerned about that you're not seeing in the Caribbean reporting?
Like, I'm looking at the different graphs and so on, the way the data is being presented, in terms of the how updated, how up to date the data is, as compared to where we are concerned. We don't get it like that, like as real time present time.
But I mean, I don't know. Brant could tell us how promptly the data is available, but I think in the Caribbean, there is relative promptness. I think where there might be gaps but in Trinidad and Tobago, as you would know, right, they have been releasing the geographical information graphically. But I think that there are gaps in terms of the age ranges, the breakdowns on the, not that they have not, I know that they have at some stage, but I think they need to systematically give an idea of that, because I think they need to break the myth of COVID-19 being a old people disease. And the other thing, as I mentioned before, in terms of the locations, it's an angle that I spoke about with Richard last week, because he had been consistently asking, well, where are these people dying? You have the main hospitals in Cora and in Arima, where you have ICU and HDU units, and also there are people who have died at home. I think that is useful information that they, only last Saturday I heard a figure, but even then it would be good to drill down on that. But I think by and large, because geographically
if I could just,
we represent a much spread. So, who's that? Sorry.
sorry, it's Annalisa. That question was asked on Saturday, and what the CMO indicated is that out of the 90 deaths we've had, it's only 5 persons, but he didn't go on to give a further breakdown of why and the clinical settings and what was happening to persons in the ICU and HDU, which is some of the questions that we've continuously asked. What's happening? And so it's been an issue where we are not getting that scientific data coming in, though the questions are being asked.
Exactly. I know the question. Yeah, and I heard the answer about the 5 deaths at home, right? But even beyond that, and there are questions about the 5 home deaths we could ask too, in terms of in the country. But I keep an eye on the HDU and ICU figures every day, and we're not sure whether the deaths that are reported come out of those figures, because sometimes you see 2 deaths reported, but the same numbers remain in the HDU and ICU. And you want to know whether these are figures, these are people who are on general care and not HDU or ICU, or whether the 2 that died came from the ICU and the numbers were filled by people who moved up the care scale. I think that's important.
And that's the problem that we're having with our officials here, because even though the questions are asked, the answers sometimes, there's a lot of ambiguity. And it makes it difficult for reporters to properly chronicle what's happening and to properly tell the stories as to what really is going on in the clinical settings as well as the home care settings.
I agree with you, Annalise, and that's why, I keep saying that I think we need to take more of a collective approach to pointing that out and listing the questions, and I really hope that's something that we could work on. Sparkle, you have your hand up. The floor is yours.
Yes, it is basically a general statement on the presentation that was just concluded with Mr. Houston, and more so a question for, is it Lizelle Benjamin? You are asking how come that particular county in Illinois has information so readily available and in such a clear format. And here in Trinidad, we don't really, in your opinion, we don't have that much real-time information being disseminated and so on. Is it that because compared to Illinois, we here in Trinidad aren't able to lay out the information in such a clear way that you had somewhat of an issue figuring out how we're going to create our own database and how we're going to clean and sort all this data that Mr. Houston was talking about? Because sometimes I feel that compared to other countries, we here in Trinidad and Tobago, we get a lot of information. But then when we're actually faced with writing stories and really sorting out that data, we feel as though it isn't sufficient.
So what would the question be?
It wasn't basically a question for
Oh,
you
okay.
to follow up with Lizelle Benjamin, asking if that is a problem that she encounters. Because for me, I think we've been doing a good job here in Trinidad, and when compared to other Caribbean countries, I see that we do have a lot of input, or I should say, output of information coming from our Ministry of Health. So to come and compare it to another country, is it that when compared to that other country with more resources, do we feel like we don't have sufficient resources here to be able to follow some of the instructions that you just gave in terms of creating our own database?
I would start by looking at how the methods by which they are collecting the information and get their methodology is a first step towards seeing if you could get more clear data. And if not, you at least have the story on some relatively simple things they could be doing that they're not doing.
Yes, and I would also add, Sparkle, and as what was said earlier, in terms of the technology, like just being up to date with the technology, maybe we could do a little bit more, you know, as it relates to the technology and the resources at our disposal to, I guess, to better be able to present the data. That's just how I will add.
Yes.
Well, as a CUSTAD student looking in Trinidad, when it comes to presenting data, right? Mostly because our society, a lot of our societies where the information is being relayed to in terms of COVID-19, when data is being presented, and I look at it, it tends to be mind-boggling to some extent. It's almost like if they're just putting up data so that they will have something to say, so that they'll have something to feed the press, that the press could go on, that they could ask questions. But normal average society, the normal simple citizen who, let's say, doesn't have a college degree or never went past primary school level, which is standard 5 in our country, and these things like that, a lot of them actually do not understand what is being presented in the data when it is our ministries present the data in the different news broadcasting. And I think as a society, especially where the Ministry of Health could elaborate a bit more on that, or even social media in terms of breaking down the data so that the common man or the average man who may not know how to say, for example, pronounce hydroxychloroquine or penicillin or all these other different words that are out there and in the media, and instead of pushing it as, oh my God, another deadly virus, another deadly this, you know, make it more understandable for the average reader. I think that would help curve the situation of what is going on in any country or any society where we are faced with a global pandemic.
Glenda, I think that the distinction you are making is between official data and the practice of journalism. That is what journalism is there for.
Yes, that is what I'm saying.
Journalism was merely to regurgitate what is being fed by officialdom, then we probably we will get the right data, but data is just part of the stories. The data is not a story all on its own. I've just finished yesterday, I think it was The Economist did a story, and it was data driven, and the gist of it was that in countries where you had greater access to mobile internet, there was declining confidence in governments in different countries all over the world, and I think that brought a dynamic. It brought a special meaning to what could have otherwise been a very dry data story on the growing incidence of countries where you have mobile internet. Likewise, here in Trinidad and Tobago, and I know in the rest of the region, I think the authorities have been pretty good in terms of the raw data. But in terms of bringing meaning to the data, the intervention that's needed there, in addition to fill in some information gaps, of course, the difference there is the quality of the journalism driving it. I think what you're calling for there is better journalism,